All right. Well, good morning, everyone. Thanks for joining us for this week's edition of the Arkansas Broadband Leaders Network, or ABLN. And we'll go ahead and get started this morning. Quick, our agenda for today, quite a few items. On today's agenda, we'll do some BEAD updates. First, on the BEAD program, we'll look at the ISB County dashboard. We introduced that dashboard to you 2 weeks ago. In that time, we've embedded it within our website as well. So we'll show that off this morning and how you can access it. We'll have a quick update from our partners, specifically NTIA and Philip Powell this morning. Cam will give us some updates from the digital opportunity side of the office. And then our content for today for you, Ms. Mary Larkin Furlow with Heartland Forward will update everyone and introduce their new telehealth digital learn module. It's really exciting stuff and it'll be beneficial and impactful for Arkansans. So we'll take a look at that and then open up the floor to discussion and Q&A. All right, quick updates on Arkansas's BEAD process. So we're still waiting, right? We can't start our first round of broadband infrastructure grants as a part of the BEAD program until we receive the green light from NTIA. And so what we're waiting on right now is for NTIA to approve those old mapping challenge process results that we've talked about for a long time now, okay? And earlier this week, on Monday, our team published an updated list of eligible locations for the BEAD program and also an updated reference price data set for all of the CBGs or census block groups across the state. So in that latest update, that is most beneficial for our ISPs as they continue to get ready for this process. In this latest update, we had 87,100 BEAD eligible locations across the state, okay, including our community anchor institutions, okay? There were over 1,500 BEAD eligible census block groups or CBGs across the state, and the total estimated grant cost statewide at this latest update was around $538 million, okay? In this latest update that we put out this week, the greatest impact was in two counties, Garland County and Jackson County. Those were impacted because we had, those are counties that we had round three projects that were given back to the state, okay? So we had to incorporate those locations into the BEAD program. So with that update, those were the two greatest impacts to those two counties. And then just this week, as you can see on the next bullet, just this week, our team was talking with USDA, the U.S. Department of Agriculture. Hypothetically, there are a few broadband infrastructure grants that USDA is running, okay, that could have some impact here in Arkansas. So NTIA and USDA and our team huddled this week to work through that, and so we're probably going to have another revised data set relative to our BEAD map coming in the next week or so. So we'll put that out as soon as we can and update everyone on our next call for that, okay? And specific to BEAD, our internet service providers around the state are still in the course of getting pre-registered for the program. So to date, we've had, as of Monday actually, we've had 35 ISPs across the state that are fully pre-registered for the BEAD program, 4 additional ISPs that have completed the process but are under review by our team, and then 5 ISPs that are still in the process of pre-registering to date. So all of those pre-registrations and kind of the stats on that are available on the Arkansas BEAD webpage. And what I'm going to do is bring that up shortly for you. Let's see if we can bring this over. Are we seeing the website? Or is it still the PowerPoint?
Yes, we can see the website.
Okay. All right. So on our website, or the web page for the Arkansas BEAD program, if you scroll down, okay, and get through all that stuff, and you scroll down to Arkansas State Broadband Office Resources, one of the accordion tabs under that heading is going to be ISP pre-registration. Okay, and if you click on it, okay, as of November 4th, which was Monday of this week, we are now putting out a list that's publicly available of all the ISPs that have been fully pre-registered for the BEAD program. So you can see them there, and also kind of giving you updates as far as numbers of other categories. So in addition to all the fully pre-registered lists that you see here, we're also letting you know that there are 4 ISPs under final review by our team, and 5 additional ISPs that are still in the process of getting pre-registered. Okay, so that's available for everyone publicly. We're going to update it once a week as we continue to move forward towards the opening of round 1 in the BEAD program. All right. We'll go back to PowerPoint, which everyone should see at the moment. Last week we talked about the ISP County Dashboard. Well, 2 weeks ago on the last call for ABLM, we talked about the ISP County Dashboard. At that time we had a link available for you to go and look. Since that time, we have now embedded it within our website. So we'll show you that in just a second. But again, a couple of things. If you notice any errors as you use it, please let us know. If you have trouble contacting an ISP, please let us know. And always use our email address, broadband@arkansas.gov, to get to our team. And we're going to continue to update this dashboard over time. So as new releases and new information and new data becomes available to us, we will update that dashboard. So I'm going to click on the link. And if you scroll down to our mapping section of our access page, you're going to see again in the accordion dropdown Arkansas County ISP dashboard. So if you click it, it's going to automatically load. Let's give it just a second. And there it is. And if you go down to the bottom right and just click this little full screen mode, it will then open your screen for you. So again, great tool for the state, and we hope that you utilize it. The PowerPoint back up. All right, at this point we'll go to updates from our partners. Good morning, Philip.
Hey, morning, Glenn. Thanks. Yeah, as you mentioned, the challenge process results we're almost there. So it looks like all the data's there. And so the next step will be on our end at NTIA, where we'll package everything together and get it signed off by the Assistant Secretary, hopefully in the next couple of weeks. But we'll see, it's the federal government, but we're working as fast as we can. And in y'all's, I know that the initial planning funds have been approved, which is great for y'all. So things are moving along for Arkansas in great position. Arkansas still has plenty of time. When we all talk about a 365-day clock, and Arkansas, from what I see regionally and nationally, is ahead of a lot of states in terms of being prepared for the sub-grantee selection process. So Glenn and his team have done a great job being really not just staying on track, but being ahead of the program. And so Arkansas is going to be in a great position when things finally open up. And that's all I have for you this morning. Thanks, Glenn.
All right, Philip, thank you for that. And now we'll go to Cam for updates from the Digital Opportunity Manager. Good morning, Cam.
Hey, good morning, Glenn. Good morning, everyone. Short updates from me today. So the file has moved from the NTIA Digital Equity team to NIST. We're currently waiting review by them. During the last 2 weeks, I think there were 3 2 weeks ago. Now there are 16 approved applications. So things have picked up with this program. So hopefully we'll hear good news sooner than later regarding this program. That's it for me. Next, I'll introduce our featured speaker, Mary Larkin Farlow. She is a senior manager of Connecting the Heartland initiative within Heartland Ford, and she's going to introduce their new innovative program, around telehealth. The floor is yours, Mary Larkin.
Thanks, Cam, and thanks, Glenn. It's good to see y'all today. As Cam said, my name is Mary Larkin Furlow, and I run the Connecting the Heartland program here at Heartland Forward. I am going to just pull up a little PowerPoint, and we'll walk through it and to talk about the telehealth initiative. I think y'all should be able to see my screen, but let me know if not.
Yeah, we can.
Perfect.
It's in sort of presenter mode.
Oh, okay. That's
yeah.
good for me to know. Let me see if I can get that sorted. Just a second. Just for those of you who don't know what Heartland Forward is, I'll give just a bit of a brief overview on Heartland Forward, and then we'll get started. So, okay. So I'll just tell you a little bit about Heartland Forward. I'll talk to you about our telehealth module and the materials available with the telehealth module. And then I'll tell you about the event we had at the Fayetteville Public Library around this module back in October. So Heartland Forward is a nonpartisan think and do tank dedicated to being a resource for states and communities in the middle of the country. We are based in Arkansas, and I'm an Arkansas girl born and raised. And so love that we get to do lots of great work in Arkansas, but then also in the states surrounding Arkansas. We do our work in about 4 pillars, which is innovation and entrepreneurship, human capital, workforce development, health and wellness, and regional competitiveness. I sit in the regional competitiveness pillar, where our Connecting the Heartland initiative sits. So these are our 20 states. As you can see, Arkansas is right there in the middle, and our Connecting the Heartland work exists in Arkansas, Louisiana, Oklahoma, Illinois, Ohio, and Tennessee. But we do work in all 20 states across our 4 pillars to help kickstart economic growth in the Heartland. So as I mentioned, I sit in the regional competitiveness section with our Connecting the Heartland initiative, which I'm sure many of you have heard of, but we believe that affordable high-speed internet is the #1 economic issue of our time. I know that is preaching to the choir on this particular call, but we do believe that because it's so important to have access to high-speed internet in order to be a full participant in the 21st century. And so what are we doing with this initiative? Well, we look to boost availability, affordability, and adoptability in internet service in the Heartland. We've worked on low-cost, high-speed programs, state policy implementation, building connections, helping communities move from that planning grant period to the implementation period, and also putting boots on the ground to increase high-speed internet adoption in the Heartland. We do that by affordability campaigns, our fellows, which we have one of in the Arkansas Broadband office, our Accelerate program, helping with digital equity plans. We also have a jobs board that's currently based in Arkansas and Louisiana to help promote the broadband industry jobs as those dollars start to come in. Hopefully very soon, as Philip and Glenn were discussing. And then also we worked with the Public Library Association to create the telehealth module that I'm about to tell you about. So the module itself was created in partnership with the Public Library Association, and it's meant to be a digital skills module about telehealth. So to help people who maybe just got internet access for the first time, or have never used telehealth before, or maybe are a little bit scared of it, or just unsure how to use it, to help upskill them with those digital skills to be able to take advantage of telehealth. Again, I'm sure most of you on this call know the benefits of particularly rural communities being able to utilize telehealth so that they can, avoid having to drive 2 hours both ways to see their PCP or speak with a specialist who lives maybe outside of the state for their particular, medical needs or whatever. And so we wanted to help make sure that people felt comfortable around telehealth and we're able to utilize it so that we can have healthy communities, because healthy communities are economically vibrant communities. So it sort of walks through what telehealth is, which is a way to see your healthcare provider using a computer, tablet, or phone without visiting their office. This is what the module looks like online. It is on the Digital Learn platform, and it's totally free for anybody to use. That is a website that the Public Library Association works with. I'll make sure that Cam and Glenn have these slides to send out to y'all, but there is a link to the module here for you to click on. But this is what it looks like. As you can see, it's 4 different sections, about 39 minutes if you just walked through the module on your computer on its own. But we also worked with the Public Library Association to create a presentation on the module so that if somebody maybe didn't even have the skills to walk through a module, they could still get access to this information and feel comfortable using it. So this is what one of the little lessons looks like on the module. When you click on it, you've got some fun animation and fun examples to help people get comfortable with telehealth. It covers what is telehealth, using the patient portal, which includes, creating the account and using the messaging feature and all of those things, technical requirements. So what kind of device do you need and how can you help fix common problems that you're having with your device, and then what to expect when you're attending the appointment via telehealth, what to prepare, what the doctor might say, how to make sure that you log in appropriately, all of those things. This module is meant to be a digital skills module about telehealth. It's never going to, provide medical advice for anybody by any means. And we also took really great care to make sure that we cast a wide net in terms of when we talk about healthcare providers, so that as people walk through the module, they know that telehealth is a great resource for them for not just their PCP, but also nurses and mental health and, PT and OT and, all kinds of healthcare providers. So I just wanted to flag for you guys that we made sure that this information was discussed in the module, that, we say healthcare provider, but that could be a doctor or a hospital or a home health agency or a pharmacist, depending on what that person needs from their telehealth visit, right? We also talk about the types of care described in the module, and what you can do with the telehealth, so that, it's scheduling appointments, it's discussing results or following up on medications or surgery or even preventative care, mental health, all of those things, to again make sure that people going through this training understand that telehealth is more than just a quick meeting with your doctor. It could be all kinds of things, and that there's real value in learning these skills so that you can, receive all of these various kinds of care with telehealth. We designed a mock-up patient portal. We just called it the Heartland Health Skills Patient Portal. Again, obviously every doctor's patient portal is going to look a little bit different, but we did design this particular patient portal to be sort of a good basis for people to get an understanding of what a patient portal might look like and what you might be able to do, communicate with your doctor or access their notes or test results, and all of those things. There is also specifically in the module, it walks through what to do for parents and how to, access a patient portal for their child or, the minor that they are the guardian of. And we made sure to do that as well. In addition to the actual module, we created materials to help librarians walk patrons through the module. And so it includes, instructor and participant handouts and also a customizable PowerPoint. This is so that, if librarians wanted to host a event where they helped people walk through this module, they could do that. And then those participants could go back and just go through the module themselves online if they needed a refresher. But we wanted to make sure that this module really appealed to and was accessible to people of all levels of digital skill, from, almost nothing to however much skilling they might have. So there's lots of presenter files. Again, I've linked to them here for you guys. There's a little certificate and some instructor and learner handouts, and I'll click through what those look like here. These are what the slides look like. Again, you can see they're customizable, so you can say the instructor's name, put the library logo, all of those things. There's also, notes within the slides to help walk through them as an instructor. And there's also moments in the slides where you can flag, and I have done this as I have walked through this training, but you can flag really great local and statewide resources specific to the state. We created this module to be applicable to all of our 20 states, but obviously, you know, Arkansas is going to have some great telehealth resources that Missouri doesn't, just because it's a different state. And there may be even some hyper local resources that we wanted to make sure people had the opportunity to know about. And part of the reason we partnered with the Public Library Association and tailored this to be toward libraries and librarians was that, you know, librarians are such a key resource in our community, and they often know about a lot of great resources in the community that are really specific to those communities. So there's a great opportunity in the slides to be specific about what is relevant to wherever the training is being held. So here's the instructor guide. It'll walk any instructor through how to present this, or, you know, just sort of give them some scripts and everything. There's a learner handout, which you can give to the participants so that they're learning about the program or about all the materials, and they can take that home with them as well. And then there's just a fun certificate of completion that you can fill people's names in as people feel like. So we created this module, and then we hosted an event at the Fayetteville Public Library. And what that was actually a train the trainer event. And so we brought in librarians from around the state and around the region, and actually trained them on how to train patrons on this telehealth module. So we walked through the overview of the module, which was a little bit more in depth than what I just shared with you guys, more in depth for walkthrough of the presentation materials. We talked about tips on presenting the module, you know, things to think about, especially as you're discussing healthcare, additional telehealth resources in Arkansas. I had flagged some of those for our librarians, just in case they didn't know about that. And then we also sort of walked through some example and practice within the module itself and the presentation. I've also linked just to some coverage of the event if you were curious and wanted to know a little bit more. We got some great coverage on it, and I think found that all of the attendees found it really helpful, and it was really exciting. And so at the end of the Train the Trainer event, librarians had, you know, learned about the basics of telehealth, learned about the module, and then built skills to present it to patrons, to work with patrons on telehealth digital skills, and then to identify those telehealth resources in their state and local community as well. And then once the librarians have been can train their patrons on it, the patrons will have, you know, learned about the benefits of telehealth, built skills to create an account with the patient portal, message their provider, you know, identify the appropriate device for a telehealth appointment, you know, identify how to fix common technical issues, and then prepare and attend the telehealth appointment themselves. I am happy to take any questions as you guys may have them. I also, you know, just want to flag that we are so grateful for this module and for our partners that helped us with creating it, but then also that, you know, we are so happy and excited that this is available for everybody, and are happy to come to various communities in Arkansas and walk through this module, whether it's, you know, a training or a Train the Trainer event. We want all of our communities in Arkansas to feel like they have the skills to attend a telehealth appointment, because as I said earlier, healthy communities are economically vibrant communities, and we want to help everybody have those digital skills to feel that they can participate in a telehealth appointment. So if you have any questions, I'm happy to take them. You can throw them in the chat. You can say them out loud. I'm here for a minute. Hunter, I see your question. Let me pull it up so I can actually read it. How is the model referenced by or utilized by medical providers statewide? You know, Hunter, that's a great question. It's not actually technically utilized by medical providers. It definitely could be. That's definitely an option for them. It's just that we targeted it to librarians specifically, because we felt that they were a great resource for the digital skills, and to share that out. Obviously, you know, if a medical provider found that this was helpful to help share this to their patients, that's definitely an option. But we really targeted it to librarians to be sort of that trusted resource to their communities, and to help them with the skills to do that. And part of the reason that we made the patient portal itself a generic version was because medical providers, they all have their own sort of version of a patient portal, and we wanted the patrons and the participants to have a good overview without trying to be super specific about, this is this Northwest Arkansas clinics, whatever, and this is Central Arkansas's clinics patient portal, and all of those things, if that makes sense. So yeah.
Yeah, and Mary Larkin, I think we had two of our AmeriCorps members go through the modules. I was going to let Noah and India comment on their experience going through the module. So Noah, let's go through your experience first and get your thoughts.
Yeah, absolutely. The main thing I wanted to reiterate is how simple the module is. As soon as I hopped in, I was able to tell that it was made for people with little to no understanding about what telehealth is. And then it thoroughly went through kind of each step of the process, even allowing you to select, like, okay, how might I do this on my smartphone versus how might I do it on my laptop? So just from my experience, it's a very well polished, deliverable lesson that takes about 45 minutes to complete, and it is highly accessible to the population.
Very good. Thanks, Noah. And India, you went through it as well, and what were your thoughts on it?
Yes, can you hear me?
Yes.
I enjoyed it as well. As Glenn knows, I was telling her, I was like, I want to try to run this with my granny and see how she likes it. And I think she enjoyed it. I think it was a little bit intimidating for her because she is older and she doesn't use technology. But I feel like it's a good step as someone who is more experienced in making it a teachable resource. So I think as someone who is experienced, it's like, okay, like this is easy to do, but it's also someone who is experienced and would like to help somebody go through the module. It's also a very teachable module, which is something that I enjoyed. But I really liked it. I think Noah really hit all the high points, but I liked it in the sense of I could do it myself and I feel like I could teach it to somebody else.
Yeah, very good. Very good. Thanks, India. And Mary Larkin, it looks like there was another question.
Yes, from Seth. Seth asked if there's any indication from libraries about which populations may get the most immediate benefit. That's a great question. I don't think that we really have gotten any indication, just because I think that each library is going to have, a different population that they feel like is really going to benefit. Obviously, I think seniors is one of those populations that a lot of librarians are going to feel benefit from that well. But we really wanted to create the module to be accessible to any and all, populations, from seniors to maybe those who just live in rural communities and don't have a ton of technological understanding or digital skills or whatever. We really tried to make it very simple and straightforward for whoever might be needing that, and to cover a lot of bases. So we haven't really gotten any indication from libraries about what they think is going to be the population with the most benefit, but I think part of that just depends on who their patrons are and who they're serving a lot, right? And that's just going to vary across library to library. But we wanted to make sure that the module would cover all of those patrons across library to library. Jeff asked if there's a cost for this training. Nope, it's completely free. The module itself lives on the Digital Learn website, which is totally available for anyone. And then we have great partners who are helping to support our work in terms of the Train the Trainer events across the Heartland and across Arkansas. So nope, completely free for anybody to get the training, and we wanted to make sure that was open and available for everyone.
Yeah, great question, Jeff, and great answer, Mary Larkin, on no cost for this training.
We love that.
Yeah, and while we wait for additional questions around the telehealth module, I do want to say we can take questions regarding anything else that was in the presentation today. So I do want to circle back to Todd's question from a little bit earlier where he asked, and this was in relation to the ISP by county dashboard system, are all ISPs that have reserved territories in each county represented in the broadband drop-down filter list? So what I'm going to do is bring the website up again. So this is remember, Broadband broadband.arkansas.gov is the home website for our office. And within that, top left corner, we have our three pillars of broadband, right? Access, affordability, opportunity, and also a direct link for BEAD, for the BEAD webpage, because that's our, program at the moment. On the access page, that's where the mapping resources sit, okay? So if you scroll down on the access page, again, and in our mapping section, that's where we have it embedded, and I'm going to bring it up, and this gets to your question, Todd, in just a second. I'm going to open this out. Okay, so your question was, are all ISPs that have reserved territories in each county represented in the broadband drop-down filter list? So there's several layers of data that go into this dashboard, okay? The base layer of data comes from the FCC and the reporting that ISPs do to the FCC about where they serve locations with internet access, okay? So one of the key features that's really interesting, and we have told our ISPs, they know that this is available for folks, and we have asked them to check on this, and if they notice any errors as well, to let us know so we can fix it. And if you click on any particular ISP that's listed, let's say, let's do one that's going to be, more statewide. I'm just going to go randomly pick one. If we went, well, let's say Ritter, okay. Click on that particular provider. The counties where they have access for folks are going to light up across the state, okay? So Ritter, you can see that the counties have lit up for you. That's an indication that that particular ISP has provided services or is providing services in that particular county at some location, at least one location in the county, okay? So that's sort of an easy representation for folks to go and look and see if they notice any errors or anything like that, they can let us know. And again, you can do that for any particular provider. You click on their name, and the counties with which they operate are going to light up for you. You can continue to do that for any ones that you want. Okay. So I hope that is helpful, Todd. If that's not, if you need more of an answer there, just let me know, and we'll expand on that. Okay. We'll give it just another second. Again, any questions related to the telehealth module or anything else that we talked about today? And while we wait for any additional questions to come in, for those that have not seen the dashboard, Arkansas County ISP dashboard, you can select counties from the left-hand side and do it that way, or you can select on any individual county. And as you do that, whether it's from the filter on the left or the county on the map, it will filter for you in the list below. Okay, so for instance, in Logan County, 12 ISPs operating, and they're all listed for you here at the bottom. All right, let's see. So Jeff asked, let me admit that person. Is the Arkansas BEAD map updated with challenge data? So if we go to the other, the state broadband map itself, you'll notice here that the update was as October 8th. We'll have our team work and double check that. So yes, the October 8th update should have been inclusive of challenge-related data as of that date, okay? So again, remember earlier this week, we put out some revised data that will have not been reflective of the public-facing map at this time because the latest update was on October 8th. So the challenge data as of October 8th should be reflected in the broadband map. So Jeff, answer yes, but there has been one update since, and so we'll have to work on updating it again, okay? Let's see, Todd followed up. How about ISPs that have reserved territories but are not actually active? I mean, have not yet provided any services. So are we talking about grant awards? Todd, if you want to come off of mute, just that should be accounted for. That's one of the reasons that we have asked all of our ISPs to go and check, because we can make tweaks to the backside, and we already have done that for a couple of folks, Todd, so we have had to make some adjustments by hand in the data sets. And so that's why we told everyone to go check it out. So please, if you're a provider in Arkansas that has been subject to a grant award and you haven't yet built out, please check those counties. And if you notice that they're not there, please let us know and we can tweak that. Okay. Let's see. Akili, why don't you come off of mute real quick and talk about the technician program? A, remind everyone about our 4th program now in the Arkansas Fiber Academy, and B, the latest news that you have.
Yes. So the University of Arkansas Hope Texarkana, we had started our first program for fiber technician, and it's a 9-week program, and it is under the Arkansas Fiber Academy, of which there are currently 4 programs. So lineman, aerial. So each college around the state, they are able to take folks from around the state to make sure that we have enough of a workforce to do all of this work that we're talking about, so that we can get broadband across the state. So ours was initiated, joined the Arkansas Fiber Academy sort of after the fact. It was initiated by one of our board members who works at Walnut Hill Communications here locally, part of County Communication. And they wanted to make sure that we had more local technicians, broadband technicians. So we gathered together all of the, or several, I should not say all, several of the larger ISPs in the area. We talked about what their needs were, what were the competencies that we wanted to see in employees coming into the space. We worked on a curriculum, and ultimately we landed on a pre-made curriculum, but we did the work of making sure that we knew everything that we wanted to go in it. There just happened to be one that was already in operation, and so we are licensed to administer that curriculum. But the best thing about it is we've established a relationship with them in that our instructor is allowed to give feedback on the content and the testing to make sure that it is currently up to standard and that it is really relevant to our guide.
Yeah.
So we were funded by OSD.
Yeah, yeah. Just to hop in real quick. So right, so it's the 4th program added to the Arkansas Fiber Academy. I always like to hit on tuition is free for folks who go through this program.
Tuition is free.
Free. And then so how many? And yesterday you said you graduated basically the first cohort. So how many folks were able to get through the program for the first time?
9 out of 10. And the last one was a hair's breadth, so we know that we can take them back through the program and that he would have.
Okay, fantastic. So we had 9 new fiber optic technicians that are ready for the broadband workforce in Arkansas. So that's really, really exciting for that program. So thank you for that update.
You're very welcome.
All right, Akili, appreciate it. And yeah, Todd, so for Resound, what I would suggest, have had conversations with Alicia already, but that's an example where we would encourage Resound to, let me go back to the mapping. On our county dashboard, I would encourage Resound, along with any other provider across the state, to click on their name and ensure that the counties that are reflected on the map are the counties where they either A, are offering service, or B, have a grant award, and they will be offering service. All right. So we'll give it just another second for any additional questions. All right, Angela with Cox, saying that their grant award county is included, which is great. Let me go click on Cox real quick. Cox Communications. The footprint for Cox. a moment. Yeah, Jeff. So Jeff is asking what is the phone number and name of the person who spoke about the Fiber Academy. So Akili was talking about the fourth program now, that the fiber optic technician program that's been added down at Hope Texarkana. And so what we can do, Jeff, in the follow-up email that everyone gets after these calls today, that's inclusive of the PowerPoint slides and also some notes, what we'll do is include contact information for the Arkansas Fiber Academy and those four programs. Okay, remember there's four programs around the state, and so we'll list contact information for those programs. You're welcome. All right. Well, with that, we'll thank Mary Larkin for joining us today and giving us a great update and insight into the new telehealth module that's available across the state of Arkansas. We'll look forward to working with them to help continue to push information about that particular module. Thanks to Philip for joining us to give us an update from NTIA. Again, everyone will get updated email of communication from this call after we're done, and we will see everyone in 2 weeks. Thank you, everybody.